Hello, my name is Dr. Lin from Sunrise Urology in Gilbert, Arizona. We are very fortunate in that we have been able to run a very successful practice. As a result, I end up fielding a lot of questions from other practice administrators and physicians regarding how to run their practices. One practice administrator recently wrote and said, "Have you ever had patients threaten to go to social media? And if so, what do you do about it?" This was over a policy and payment dispute that the patient had agreed and then later changed his mind and did not want to pay. So, what do I do in this situation? Well, I can't dictate what the patient wants to do on social media. So he or she is free to leave any comments. As the patient had agreed on the policy and had agreed to pay for the procedure or the service, then I think you should hold up your end of the bargain as you have already provided service, and you should collect on the service. You certainly can't work for free. Your employees are not going to work for free. So that's what I would do in this situation. More importantly, when you get your negative review, because you will get negative reviews on social media, on different review sites for your practice, you should know how to respond to them. Gone are the days of 10 out of 10 or 5 out of 5 reviews on review sites. As a matter of fact, if you have a perfect score on your social media online reputation reviews, that may make it so that it's not real because you can't make everybody happy. So having a few negative reviews almost gives it more credibility at that site. So take that with a grain of salt and kind of think about that. Very importantly, what do you do when you get these negative reviews? You certainly never want to get into an online argument over the review that was left for your practice. You want to acknowledge and thank the patient for leaving the review, and you want to acknowledge that they were inconvenienced because of whatever happened. Usually it's over finances or policies and procedures. Whatever the case may be, acknowledge that the patient was inconvenienced. Should you find that your practice had room to improve and you have come up with policies and procedures to improve your practice, then certainly write in the response to that negative review that you have made changes based on the review and evaluation of what happened. That is going to look great, and it shows that you care and that you are doing something proactively to make the situation better. You certainly never want to disclose any medical information regarding the reviewer and violate HIPAA policies, privacy policies. Okay? And the only way that you can counter these negative reviews is to overwhelm the few negative reviews that you will get with positive reviews. That is the only counter you have. How are you going to obtain these positive reviews? You can give the patients a little piece of paper, which I don't find to be too effective, or you can collect the patient's email addresses and send the links to the specific review sites where you want your patients to leave reviews for you. I think that's probably the most effective way, instead of having the patients fill something out in the office electronically or on paper, or giving the patient a piece of paper to fill out once he or she gets home. Believe it or not, most patients are extremely happy with your services. And if you ask for reviews, they most likely will oblige and leave positive reviews. I would highly encourage everyone to, number one, monitor their online reputation, and number two, collect those positive reviews. We currently have over 2,000 actual patient reviews on DemandForce, which is a service that we use. And I think we have over 60 Google reviews. So those are very, very important. And believe it or not, most patients and most potential patients are looking at your online reviews, and your online reputation is hugely important if you want new patients. So hopefully this has been helpful. If you have any questions, please leave them in the comments below. Take care, and I hope everyone is going to do very well. Take care.